While introducing yourself, sanitize your hands and put on your gloves. Explain the procedure to the patient and why it's required. Ask for their permission. This is obtaining informed consent. Choose the needle size that is most appropriate to the situation. Check the expiry date and then open it from the package. Keep the needle in the package until you're ready to use it. Take the tegaderm out of the package and create a crease in the paper side. This makes it easy for you to remove the paper from the sticker when the time comes. You can use a pre-filled normal saline syringe, as shown here, by checking the expiry date and removing it from the plastic. Remove the saline lock from the package. Leave all caps in place and leave the lock inside the plastic itself. If you do not have a pre-filled syringe with normal saline, you can build one yourself. Use a 10 cc syringe and a filtered needle. Push the filtered needle through the paper side. Screw it together. Attain a 10 cc vial of normal saline. Check the expiry date. Take the cap off. Do not touch the top. Withdraw 10 cc's of air and insert your needle into the top of the vial. Withdraw the solution until you have 10 cc's of normal saline. Remove all the air bubbles from the solution and place the cap safely back on the needle. Remove the filtered needle from the syringe and attach it to the needleless port of the saline lock and flush the saline lock. When finished, put it back in the plastic. Prepare 3 pieces of tape. Put this somewhere where it's clean and easily accessible when you are ready to use it. Lastly, open the alcohol swab and prepare it for use. It is now time to start the procedure. Take a look at your patient's arms and hands. Assess for the best site of IV initiation. Look for blue, green, or purple under the skin and identify veins. Place the tourniquet proximal to the site of IV initiation. Ensure it's tight, but not restrictive. Gently tap the back of the hand or ask your patient to squeeze their hand 5 to 10 times to encourage venous congestion. Then choose the best site for IV initiation based off of the bulging of the green, blue, or purple areas. It is now time to clean the area of insertion. Moving from inside to outside in a circular fashion, allow the site to dry for up to 30 seconds. Uncap the IV with a straight, smooth motion. Do not twist. Do not touch the end of the catheter and ensure that the bevel of the needle is facing up. Using your index finger to hold the IV catheter in place and your middle and thumb finger pinching the ridged areas of the IV, insert the IV into the vein. Pause to watch the blood fill the blood chamber. Once it has filled, move the catheter off the IV and the IV needle back into the housing until you hear a click. Remove the tourniquet. While maintaining stability of the IV, remove the paper component of the tegaderm and place the tegaderm over the colored portion of the IV catheter. Remove the paper off the tegaderm. Then press the tegaderm firmly down in place. Remove the cap from the patient end of the saline lock and block off the end of the IV catheter in the vein. Use your index finger to maintain stability of the distal end of the IV catheter. Connect the saline lock with a twisting motion. Confirm placement by pushing the saline into the IV. Check for signs of infiltration like bubbling proximal to the IV site or difficulties pushing the saline. After you've disconnected the pre-filled syringe, lock off the saline lock. Prepare your tape. It is now time to tape down the IV. Pre-hospitally, we will utilize a chevron, which is what's demonstrated currently. The in-hospital method does not utilize this piece of tape, but the next two pieces of tape are placed as seen in the in-hospital environment. When pulling the loop around, ensure that you do not pull it so tight that you create a pinch point. Most of your tape should be over top the tegaderm. Perform hand hygiene and put on your gloves in front of the patient. Explain the procedure to your patient and the need to discontinue the IV. Explain what's involved in discontinuing the IV before you start. Begin by removing the pieces of tape in the reverse that they were put on. Hold the IV down with your fingers so that you don't inadvertently tug on the IV, as this is when the most discomfort is created through this discontinuation procedure. Prepare the sterile gauze by opening it and folding it in half or in fours. You can put it in your hand while you complete the discontinuation procedure. While holding the IV down with one hand, remove the tegaderm. Place the gauze over the site of initiation and in one smooth motion, remove the IV. Hold pressure over the wound for up to 5 minutes, or if your patient is compliant, you can have them do this themselves. Place the used IV in a biohazard container. Place tape over top of the gauze, or if you have a Band-Aid and the patient would prefer, please use that.